So I'm going to jump into my like physio school brain here because we have clinicians and we have individuals on concussion journeys that definitely tune into this podcast. And we have all ranges of levels of knowledge and education that listen here too. So when I was in physio school, cervical instability meant spinal cord damage and you were going to end up in a wheelchair. But I feel like, and I know from my own clients, there's degrees to that. So can you, because what I don't want to happen is people hear cervical spine instability and we start to ignite fear. So can you give us some more, explain what that means and the kind of the spectrum of that a little bit more to the listeners?
Sure, of course. So there are different grades of ligament laxity. So you have your grade 1, 2, 3, 4, and 4 being diagnosed as a full rupture or complete irreversible damage to a tissue. When instability has generally been talked about with relation to the cervical spine, you're right. It generally focuses on everything below C2 where the discs are. And if a fracture happens above that, that's very notable because they can see the fracture. And so there's something that, the medical community sees that can be done to things that are fractured or no longer connected as far as bony tissue. But when you're looking at some of these soft tissues, such as ligaments, it's not readily evident generally at the start that has occurred. It's usually because the symptoms continue to persist, whereby therapies don't stick, treatment protocols don't really run as they normally would with your average person that comes with a suspected neck. And so yes, when you have mid to lower neck instability, it can irritate the spinal cord, and then again that would cause stuff downstream. But when you're talking about stuff upstream back into the head, it's not common that stuff below C2 would trickle up there. It is possible, but it's generally at the level of C1, C2, and then the skull and C1, which would be termed C0, C1. When you have instability there, that tends to kink the brainstem region where drainage of the CSF from the brain, which is made in the brain, needs to occur at the same rate as it's being produced. And so if you have kinking of that ever so slightly, you're producing more than you're draining. And so by default, it trickles back up in and it actually starts to accumulate inside the brain, whereby you get distending of the ventricles or the cisterns where the CSF is made. And then that compresses the brain, and you then experience, headaches and brain-related symptoms, which would be deemed, concussive. And it's not necessarily the brain itself that is the main factor of that symptomatology. It could very well be the brainstem being kinked by an unstable C1 or C2, causing less drainage to happen, thereby backing up into the brain. And then when you get the distension, the skull is a fixed entity, so it can't expand at the same rate as fluid accumulation can, and so it starts to compress brain tissue. And there you have then the symptoms that could be diagnosed akin to the concussive like pattern. And so instability is, I think, probably one of the most overlooked things in medical care or let's call it manual medicine, where we're dealing with spine and joints. Most of the focus is on restrictions in movement. Unfortunately, there's a lot of people out there, especially the ones that don't respond to the therapy the normal way that they would expect to be responding to it, is that their actual underlying problem is not restricted motion in the joints. It's actually excessive movement in the joints, which then causes the muscles to get rigid and start to compensate for that and guard. And so the expression is a lack of range of motion, but it's not a true lack of range of motion in the joints. It's a lack of range of motion because the muscles have overreacted and properly so to an actually over mobile joint system.